Tēnā koutou katoa. It's a childhood trauma during the lockdown. So as most of us are aware, we're in the midst of a pandemic caused by coronavirus. Around January this year, we found out there was a cluster of pneumonias in China. In fact, they probably started back in December, and this was caused by a novel coronavirus that we've come to know and love as COVID-19. This is a snapshot of the figures, which are now out of date because there's more than 16 million cases worldwide and 650,000 deaths worldwide. So that's the coronavirus, and of course it's caused chaos throughout the world. Back in March, 11th of March, it was declared a pandemic. And here in New Zealand, we had our response led by our two great leaders, Jacinda Ardern and Ashley Bloomfield, the Director General of Health. We, as you know, had a series of levels, level 1, 2, 3, 4. So we entered level 4 on March the 25th, and we stayed in level 4 for 33 days. During level 4, restrictions were quite severe. Hardly anyone was out on the road. Everyone mostly stayed at home, most adults and pretty much all children. And so during this time, we anecdotally noted that trauma seemed to be decreased. And Matt Sawyer, who you know well and who's now famous, thought that we should take a look at our numbers. So as soon as the level 4 had dropped down to level 3, we looked at the amount of trauma that had come through our doors. What we did is we took the dates, the 25th of March until the 27th of April, those 33 days, and we compared those to exactly the same dates on the 4 previous years, and so we had 5 years of data, and we did some stats on them. And as expected, we saw that the number of trauma patients admitted during that time period had dropped, and it was down to 2/3 the normal level on average. The amount of major trauma, which is in the orangey red there, also dropped by 2/3, but because this is a short time period and our numbers aren't that big, that was only a drop from 6 cases to 4 cases, so we didn't get any statistical significance on that, but it did seem to be a drop in trauma across the board. The interesting thing about the major traumas, and this is a graph of the age on the y-axis, and again, 2020 figures are on your right-hand side. The age of those major traumas was really young. So those little kiddies were around a year or less than a year of age, which is a big drop from the usual sort of average age, which I don't know what the reason for that is, but maybe it's because that the only major traumas we saw were little kids like having injuries at home, and maybe the older kids just weren't out there on the roads to get hit by trucks and cars like they normally do. So that takes us on to the place of injury, and of course most of the injuries were at home, and all around the streets, around people's homes, and pretty much no injuries on the road except for one child who was admitted on the road, like on a farm, private property, and there was another pedestrian injury, but they were transferred in from another country to us. So really no road trauma, and this is like the cause of injury. Once again, in the orange, that's the road injuries, which were made up those 2 pedestrians. But as you can see, the green, cycling injuries increased quite a lot during this period, and we probably all know why. Around my suburb, there was just kids on bikes all around the place. It reminded me when I was a child, it was actually safe to jump on the bike. Most of the time, we wouldn't let our children go anywhere near a bike on a road. They'd be run over by some tradie in a ute or something. Anyway, so the number of cycling injuries increased 5-fold, and thankfully these were pretty much all minor injuries from falling off their bike. Other injuries, as you can see there. Okay. So now I thought we'd just try and reflect on what this really means in terms of our injury prevention. So Matt and I wondered whether COVID-19 level 4 was actually the ultimate injury prevention tool. I still believe it is, but most people want to get back to work. So injury prevention is more than about mechanisms. You can see all these kids wearing their bikes, wearing their helmets on their bikes, and that's of course incredibly important. It's actually more than even a social disease. There is some very interesting research done by Bridget Cool, which I've been involved in recently, which is looking at social aspects of trauma. And in fact, trauma is very much a social disease. It's got very specific demographics, and it's very much related to home, family, supervision, etc. But I think what the COVID-19 has shown us in the level 4 lockdown is that trauma is also an environmental disease. It's to do with our environments, our suburbs, etc. And in fact, the environment is not only to do with trauma, it's to do with our entire health and certainly to the health of our children. So moving into the health effects of COVID-19, there's interesting data on air pollution. You can see on your left, the colourful graphs is all the air pollution, and on the right is the period during the lockdown around the world. The top graph is nitrogen dioxide levels, which is a pollutant produced by trucks and cars and diesel and whatnot. And the bottom, it's ozone, but it's what people call bad ozone. Ozone up in the stratosphere is really good because it keeps out the UV rays, but ozone caused by trucks and cars is actually is a pollutant. And these are things which cause respiratory disease, asthma, and around the world people talk about the respiratory disease pandemic, which is kind of an under-recognized pandemic around the world. So that's the great effects of COVID, and people have started to think about the worldwide response as giving us sort of a glimmer of hope in that we can actually deal with our big climate problems which are facing us. This is the World Earth Day, which was on the 22nd of April, 50th anniversary of it, and this is an article in The Guardian. However, we can't take really too much credit for a response in terms of the environment, because actually we're just filling our oceans up with more and more plastic at the moment. On your left, there's just a photograph of a plastic bag in the waters around the Indo-Pacific Ocean. And reports are starting to come out now of the sort of poor environmental effects of all the personal protective equipment, the PPE that we're using around the world and throwing into the waterways when we finish with it. So that's just some views. I'll leave you with this last slide of a view of the coral reef. So we are talking about mechanisms today, and we have had quite a few drownings, so water safety is going to be one of the things. But in addition to that, I'd like to think about this paradigm shift of thinking about the health of our children and injury prevention as being an environmental disease as well. It's not only about mechanisms, it's not only social, but it's environmental. O te rangi, o te whenua, o te moana. Thank you.